So, Namaskar everyone. I'm Dr. Manish here again back. Uh, Last video, when we talk about when we were discussing about Kent's philosophies, the last lecture that I put on Kent's, where I was talking about, vitality in cancer. The topic's name is vitality in cancer, and that was a talk which I got it from the material I got it from Kent's lesser writing, and I would urge you all that you should go and watch that video because that video, that lecture really makes a lot of sense when especially you are dealing with deep pathological cases. And the question that comes always that in pathological cases, why only few times we get success and majority of time, maybe either we are just palliating or maybe nothing is happening. So after making that lecture, I got few questions from some of my colleagues. And the main question that came up was about the vitality. Because if you watch that lecture, it says, the Kent says that when the vitality of the patient goes down, as the vitality keeps going down, 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 pathology increases, then you have lack of characteristic symptoms. When you have got lack of characteristic symptoms, then there is a big problem that you cannot prescribe individualizing remedy. And when you cannot prescribe an individualizing remedy, then what happens? Then your remedy does not work. And this is one of the biggest reason why pathological cases does not get better in spite of so much effort. So the question came, of course, I will not go into deep into vitality and what he is trying to say, but the question came was, can with homeopathic medicine, we increase this vitality? Can with homeopathic medicine, we increase this vitality? Now, I will just talk about, you know, my experience through the patients. Maybe what I'm saying, you don't have to always agree with me. Remember that. Now, the vitality component, according to my understanding, it is inbuilt in the patient. It is inbuilt in the patient. It is not that our medicine or any medicine will bring the vitality in the patient. Understanding? The vitality is inbuilt in the patient. Now, how does this vitality breaks down gradually or goes down? It is not 1 or 2 day or 3 months or 1 year plan. It is a problem of many years in the back, the past, all the past history that has been done, and also the miasmatic traits, if you can find from the family history. So all the suppressions that has been done through ages, the miasmatic cause that we talk about, that is one reason. Second is in the life also, so many suppressions have been done. The suppression that have been done through, all the diseases, all the vitality was since childhood always trying to express itself through signs and symptoms, and that has been always suppressed through conventional line of treatment. Coryza, ear discharge, headache, menstrual complaint, all has been suppressed. Some tumor coming, operated, do something vigorously, all aggressive line of treatment. So when the suppression keeps happening, skin complaint comes, it is suppressed. Vitality keeps breaking down, breaking down, breaking down, breaking. So now when patient comes to us, and if little bit vitality is still there, then how homeopathy can help? I will talk about that. Definitely, in many cases, it can help. But for that, you have to see the remedy reaction. Like you give the remedy and what happens in the follow-up. You give the remedy and what happens in the follow-up. Remember, my friends, when pathology is completely taken over, completely, then it is very tough to get the real vitality out of it because the disease symptoms, the disease virulence is so high that it curtails everything. All the expression, all the things are gone. There's one very beautiful case. There's a book called Erastus Eli, and in Lacaze's chapter, there's a beautiful case of a sarcoma of a child. Maybe in some lecture, I will show that case. Maybe after this only, I will make a video of that case and try to explain you how vitality can be helped with our homeopathic medicine. So in such situation, what has to be done? Now, suppose you get a patient and then you're not getting good general symptoms, good characteristic symptoms, only disease symptom, disease symptom, disease symptoms are there. So first thing is very important you have to understand is go back and first, before you do anything, first understand the evolution of disease, from where the disease has started. Remember, my friends, we are not treating the pathology. We are treating the pathology, but what you see right front of you has to be treated. But more than important, what is happening, you have to understand what has happened. So it is very important to go back in the past and find out everything that has happened, especially all the suppressions that has happened, all the disease that patient has suffered from childhood. And this is the most important part of the case taking, which we don't do it. In fact, we are so much trained to go into other aspects of patient's personalities and mind and so many other things. We get lost completely into the case. And the real essence, why the disease has come in. We say homeopathy cures the root, but we never try to understand what is the root. So very important is go back in the past and try to find out from where disease has come. Once you understand that pattern, and then you can really prescribe some remedies to help the patient. So, coming back to the patient, when too much disease symptoms are there and you have got less data, so here the role of Burnett therapy comes very important. What was Burnett talking about? You should actually go and study Burnett's method layer by layer. He talked about that there are different layers that you have to keep on rolling on. You have to keep on, one layer comes, you remove that, then second layer comes, and third layer comes. At the same time, you are also going into the past history. You're trying to see all the diseases that he has suffered. Maybe some nosodes are required. And here only the role of sarcodes can come in. Here the role of organopathic remedy can come in. All those things that you learn about organopathy, the mother tincture, the nosode, the sarcodes can come here to an aid. But remember, these remedies are not just only going to cure it, but it is going to help you so that layer by layer, layer by layer, layer by layer, you go deeper and deeper, and then slowly the real individuality comes. When the real individuality of the patient comes, that is a time you know that yes, now maybe our homeopathic medicines can really help. So if somebody, a homeopath clinician, takes homeopathy seriously and tries to understand all the phenomena from here, from what is happening around to from where it has started, and try to address all those things through their remedies, then definitely there is some chances that you can really do something with the patient. So one is to treat what has happened in the past, and another is to treat the real thing, what is happening right now, the acute, managing the acute, what is happening right now in front of you. So you have to become very good with acute management. That's very important. So learn acute management, go back into the past and find out. So if you do like this, slowly and slowly, gradually, the vitality can increase and you can get help from the patient. So that's how that's what is my answer for the question of vitality and what do you say? The remedy reaction. But I'm telling you, if the vitality is completely gone in the patient now, there is very less that you can do in the patient. So it is very crucial, very important to go and address the past. Again, I'm saying this thing again and again because I have realized in my practice that we get sometimes overwhelmed with what is happening right now in front of us. You have got very less time, when really some blockage happens, some real pathology happens and the tissue damage is completely, taken over. You have very less time. But even if in that you get a time and you can go back and trace the, things which has happened in the past, you might get some aid to relieve the patient. And that's how the vitality can increase. So that was a small, talk which I wanted to make for my colleagues about the vitality. And definitely I'll be coming up with more videos and trying to show you cases by cases, and try to understand. Through cases, we'll try to understand how we can manage these kind of conditions in our clinical practice. Thank you. Bye.